Hello, and welcome back to another episode of ABA Mom. I'm your host, Allie. And on today's episode, we are joined by Dr. Shane Spiker, a behavior analyst. Shane serves as a clinical training and safety director for positive behavior supports, also known as PBS, and has been in the field since 2010, specializing in complex cases and home and community settings. He also teaches graduate level coursework and has contributed to research efforts across the field of behavior analysis. Today, he's here to share his expertise on providing ethical, compassionate, and effective support that truly improves the quality of life. Shane, I'm so excited to have you today.
Yeah, thank you for having me. This is super exciting. So I think this is going to be a really fun conversation for sure.
Yeah, absolutely. Shane, can you just share a little bit about your path into ABA and what led you? I know you work at PBS, so like what kind of led you into the field, and have you always worked at PBS? Is that where you started?
Yeah, that's so I never planned to do this. I think there's like two contingents of behavior analysts, right? There's the ones that planned and the ones that didn't. And to me, it sounds like the ones that planned are like maybe newer in the field because they've had some exposure. When I started in the field, we just did not have anything related to our work, right? Or like at least like it wasn't as common. So I was going to school to open a music studio and ended up hating my music theory class, dropping out of that, which is so funny because I've been a musician for most of my life. And so I was just like, oh, I hate this class. It's terrible. And then I changed to marine biology, and then I hated my biology class. And I was like, I'm not going to do this. And then I changed to history, and I was going to be a history major. And then I ended up dropping out of school entirely. And then when I went back to school, I went back for clinical psychology. While I was doing my internship, I was doing my internship with a case manager so in Florida, we have support coordinators, and support coordinators often work with adults with disabilities. And so I was interning there to get some experience because everybody knows in psychology, it's like you have to have 2 years of experience to work anywhere, but you can't work anywhere until you get 2 years of experience. So
Right.
it's like just a mess. And so I was like, I guess I'll just do a free internship while I'm working at Starbucks. And I happened to be reading a behavior program, and she was like, what do you want to do for work? And I was like, this behavior analysis thing sounds cool. And she made a phone call, and I just fell right into it from there. I mean, it was a complete accident that I got into this. And so, I started at an agency in the town I work in. I live in Daytona Beach. So I started there as a behavior assistant. So it was before RBTs existed. And then came to PBS actually to learn to work with children because in 2012, they opened up funding for Medicaid in Florida for children with disabilities. And so up until then, there wasn't anything that was available for early learners, unless it was like grants and stuff like that. So I ended up coming to PBS to learn how to work with kids, and then went, nah, I'm not good at this. So I tend to work better with teenagers and adults. And so I learned that pretty quickly, but I've stayed since then. So it's been an interesting journey.
Yeah, no, that's great. That's where I kind of fall into. I prefer teenagers and adults too. I think that's where the passion is. But I know a lot of analysts, they love the early learners. It's great. Kids are a lot of fun. I love kids. But
Yeah.
yeah, the teenagers and adults, I have a sweet spot for them too. So, but I love how
Yeah.
you just fell into it by accident. That was a great accident.
Yeah, absolutely. I mean, I think about it a lot because over the last couple of years, I've had the blessing of being able to travel around the world and be able to speak at places with this, like, which is something that, when you play in bands for years, you're like, I can't wait to tour the world. And you realize it's a nightmare to tour in a band because you have to carry your gear around and it's just gross. And so, I've had the fortunate accident of being able to see more of the world as a behavior analyst than I ever did in a band. And it's just really cool. So I'm always very grateful for it because I just never thought that I would have ever fallen into this like happy accident of sorts.
Yeah. No, that's awesome. I love the way that you started, and so glad that that happy accident happened and that you're here today because like I said, like I think you're a great speaker, and
Thank
you've
you.
done a lot in the field, and so I'm very very excited to have you today. So ethics is such an important major topic in our field. What issues have you seen most often in home and community-based services? Because I feel like you've worked in so many different settings with so many people.
Yeah. Yeah. It's so complicated. I think as far as like dilemmas go or concerns go, I think so much of it just comes from human error. Right. I think that thankfully over the last couple of years, we've had the evolution of our ethics code to come up and catch up with things like culture and like cultural responsiveness and whatnot. So I do feel like there's always that to me has always come up a lot is like just culture clash a little bit. I think that working in in-home spaces, I think multiple relationships comes up quite often and having to navigate those. So it's hard to say. I think, across all I will say across all the settings that I've worked in. So if for those of you who don't know, I've spent most of my career working in home, but I've worked in residential facilities and I've worked in prison settings as well. And so you know,
That's
yeah,
interesting.
yeah. It's kind of like a brief. It was a brief stint, and so it was maybe like a year and a half or so. And so in all the spaces I've worked in, most of what I see is treatment engagement and follow through, and people kind of like I don't want to say going rogue, but definitely kind of like issues with treatment fidelity. And behavior analysts having a hard time getting people to buy into treatment and to implement stuff. You're asking people who are in many of the spaces that I worked in, you're asking people who are working barely minimum wage, who are working 24-hour shifts, who are asked to manage people's medication and their diets and their cleanliness, and they have three people that they're responsible for, and now you're going in to ask them to collect data and implement behavior programs. And so you see kind of like this slip from not only just poor treatment fidelity, but then into punishment procedures and to harmful procedures that people, and I say punishment procedures, I say people try to implement punishment, right? But a lot of it just comes from bad behavior programming. And so that's a lot of what I see is like it just comes back to responsiveness, where behavior analysts have a hard time making responsive behavior programs to get people bought in. And it turns into a complex series of errors.
Yeah. Yeah. I think that there's a lot of truth to that. And I think that, too, like when you're thrown into the field. So when you're, an RBT and like this was like your setting and you were, like you said, like close to minimum wage, you're not making that much money. And then all of a sudden you took the test, you're a behavior analyst, you're responsible for the buy-in to write these great programs. And I find too with families that buy-in is so difficult. So it's hard to
Hmm.
write good programs, like even if it's like, okay, like this is very technologically sound, this is easy to understand, easy to follow, but that buy-in is definitely difficult, and that is an area I think that just across the board that we struggle with.
Yeah.
And then supervision kind of plays in that too. So supervision shaping the future of ABA. So what makes supervision truly effective?
I roll this question around a lot because I think that behavior analysts in general can be so procedural.
Yeah.
And so you're going into manualized, right? Going like, well, here's this manual, here's this. And I come from a psychology background. So the one thing that they'll tell you time and time again, over and over and over again, the most important ingredient in any sort of like dyad is going to be relationships. And so I don't think that we spend enough time talking about that piece of it, is having good relationships with your trainees. And of course there's lots of like complex factors with that. You've got behavior analysts who are, let me say it like this. There's power dynamic, right? So you've got a supervisor and a supervisee, and there's an exchange. You're coming and doing the work, and I'm giving you my signature for these hours. And so there is that exchange there. And I think that we would be remiss to ignore that. But I do think that so many times, because that power dynamic gets in the way, that people forget that like relationships are so important, and like we are working with humans first in every aspect. And so having that therapeutic alliance, whatever that looks like, with your supervisee or your trainee is really, really critical. I would also say too, it's just training. I think people have heard me say this before, but I'll say it again. Most of our field, I think 51% of our field has been certified for less than 5 years. 81% has been certified for less than 10. And so if that tells you about anything about how green our field is, and I have met plenty of people who go to school and they have never worked in managerial positions before. I came from a managerial position. So when I worked at Starbucks, I was a manager, and then I came and started doing this. So I had experience like managing personnel, but different, and I've had to learn some softer skills as I've gone along the way. And but it still all comes back to, no matter what procedures you use, no matter what reinforcement systems you use, it still comes back to relationships. And if you don't have a good relationship with the people you're working with, then you are going to have a much harder time trying to get buy-in and support.
Yeah. I completely agree, and like you said, all the way around. So it's with, the technicians, it's with, the parents, it's with the clients. Just like we pair with our clients, it's very important to pair with our techs because it's already hard enough to have an RBT.
Yeah.
Like, a lot of times they stay and they're like, "This isn't for me," or they had a bad supervision, or I've heard a lot of RBTs say, "This is great, like, you showed up because my analyst never came," and I'm like, "How did that
Yes.
happen?"
Yeah.
So yeah, so I think that, definitely showing up, obviously, like we need to be able to provide their supervision. That's very important. I think, as analysts, there's that big the burnout is real because you all of a sudden it's like, oh, just, this one more case, or, maybe you have a smaller caseload, but they're more intense cases and, you're pulled in different directions all the time. So I could see where that relationship kind of falls through the cracks. But I do agree that it's a huge, like, it's hugely important because if I go to work and my boss sucks, like, I don't, I may not want to work there anymore. And it gets a
Yeah.
bad taste in your mouth. Yeah.
Yeah, and on top of that too, I mean, I think that lots of behavior analysts can forget what it's like to be an RBT, or they never worked as an RBT. I've worked with behavior analysts who've never even had exposure to being an RBT. And then I think it's really easy to forget that our RBTs are busting their butts every day. They're not getting paid what they should. They are, a lot of them are going to school full time, or more recently we were kind of talking about this with like this idea of invisible labor, right? The idea that like when we work with folks, everybody we work with may have some other experience that we don't know about. They're responsible for children that we don't know about. They're the caretaker for somebody that we don't know about. And some people are so private that you would never even know. So I think I think that's like that's the circumstances view that Pat Fryman always talks about, because like at the end of the day, you just don't know what people are going through. So I think we just need to like ease up a little bit on our folks and just really kind of like just remember that we are working with humans.
Yeah. And there is also that pressure from like the insurance, like, what kind of protocol did you modify today? And sometimes I'm like, actually, the session ran great. And I want to keep all the programs exactly the way they are. Like, I like the
Yeah.
reinforcement schedule. It's great.
Yeah,
So then
exactly. Why would I change anything?
why change? I don't know what I want to change. So I'm kind of like, let's just change one thing. Maybe we have a different stimuli in our environment today, introduce a new toy,
Right. Right.
something. So there's a lot of pressure, I think, and if there's lots of pressure, it's harder because I know sometimes when I'm in like the work zone, like when my mindset's like, okay, I have to get this done, I have a heavy to-do list, it is much harder to focus on just like maybe my RBT is having a tough day. Like maybe, like their kid's sick, they had to go home and it's like, okay, great. Like now I know they're not at session. And so there's a lot of things that happen that it's just, but I think what you said, it's very important to just know that they're people first. Like everything else is kind of secondary. Like
Yeah.
insurance does take a big push, but it's very secondary to being a compassionate human. So
Yeah, at 100%, 100%. And I think too, I think some people might hear that, like what we just said, and think that we're saying that like, professionalism is important and all that stuff. And that's certainly not the
no, it's
case.
this.
Like it absolutely is, right? Like, and I have a lot of thoughts on professionalism just because I think that it comes from, systematic oppression and all that stuff. But like I do think that there is, at the very least, we are a profession and we are professionals. And we do have to hold our folks to a standard, but I think that we can still hold them to a standard without being jerks about it. And I think that we can do that in a compassionate and forward thinking and relationship forward way.
Right. Right. Yeah. Yeah. No, I completely agree too. And professionalism is still important. Just remembering that humans are humans, just like we would with anyone that we work with.
Yeah.
Yeah. So, and another thing too is self-care. So
Yes.
how do you feel that clinicians, I mean, whether that's, the technicians or you've worked in residentials like the direct support staff or the analysts, like how do you find time, like, or what are some good self-care techniques to prevent burnout but still have high quality services?
That is such a great question. Isn't that ultimately the question? That's like the
Yeah, I'm still
the
searching for it.
Hey, me too. And I think I will say our research is too, there's some really great folks who are doing work around burnout and self-care. Julie Slowiak is another person who's doing like really great work around this. Her work generally focuses on like job crafting and like occupational well-being and self-care too, which is really important. And at this point in time, what we know in our in our field, and I want to put the asterisk on this, right? What we know from our field specifically is that burnout occurs rapidly in the first year for first year BCBAs. And it occurs rapidly because of a lack of support, a lack of supervisory support, a lack of leadership support. And that lack of supervision and support in that first year results in high rates of burnout, lower job satisfaction, higher turnover. Like we know that right now, right? That's what our literature says. So at this point in time, we know supervision is the real issue, right? But we do know at the same time that burnout occurs for lots of different reasons. And if we had like a panacea of sorts to resolve that, that would be great. But everybody's life circumstances are different. Burnout occurs in spaces where we're not getting enough reinforcement, where caseloads are high, where pay is not enough, where caseloads are intense. So you could have a low caseload, but high intensity caseload. There are other life circumstances where you've got disability or mental illness, or you've got life circumstances, like all of those things contribute, right? So I would say if I were to say one thing though, to me, the key thing for preventing burnout is time management. And I bring that up because I think that good time management will allow you to do a few things. It'll allow you to set boundaries so that you're not working beyond what you're supposed to be working. I think it'll allow you to schedule things that you need to schedule when it comes to your own well-being, like scheduling doctor's appointments, scheduling in your own reinforcement, whatever that is. Like, because, people talk about self-care being like preferred activities, but it's also maintaining your health and well-being too, right? It's like eating well and stuff like that. So I think with good time management, you could do all the things that you need to. Like, people ask me all the time how I do everything that I do, and it's because my time is very regimented. Like, my time is very I am very protective of my schedule and those boundaries. And my well-being hasn't been better. It's been better in the last few years than it has in my entire career, because I say, no, I'm not doing this. I don't have the availability, and being able to kind of like say no, right? So like, if you have good time management skills, saying no is much easier to do, and scheduling things that you need to do is much easier to do. And I think that's what I would say is, like, if I were to wave a wand and give everybody the skill to engage in good self-care, I would say time management is like the number one thing.
Yeah, I think it's important that we have good time management in general, but I really like what you were talking about as far as saying no.
Yes.
Because I think, for a lot of us, because we're, at some level, we're caretakers, even though like it's in a professional and clinical way, we still want to provide, and, we want to see improvements in people's lives. So we kind of have a lot of times, like, we kind of go above and beyond because we're like, okay, like, I know this is like really good for this individual, so I want to, do this. And like, we give our time, but a lot of times we're giving from an empty cup, and we can't give from an empty cup. We have to be able to fill our own cup to be able to give. The same thing with like the airplane with the oxygen mask. Like, you have to put your oxygen mask on first before you can, put on the child's oxygen mask. So,
Yeah.
yeah. So I think that's a good one. Time management is great. I think that we all struggle with it. Even
Yeah.
non-providers struggle with it. Just adults, sometimes we struggle with time management in
Yeah.
general.
But I think at the same time too, like, time management also requires you to schedule in time for things that are not behavior analytic, right? Like,
Right.
so much of
Right.
us, I mean, I'm sure you've seen this too. So many of us identify as almost as a behavior analyst first. So, it's like, what does our life look like when we're not behavior analysts? And I don't think that we spend enough time nurturing that. More recently, I started publishing and posting like about books that I'm reading that are not behavior analytic, to kind of show like, hey, you're supposed to have a life outside of behavior analysis. And that's okay. Like, that's okay to do that. It's okay that you're not reading Skinner 24/7. It's okay that you're not analyzing data at every chance you get, right? That's perfectly fine. And I wish more people just gave themselves the grace to allow that. I love what we do. I love our science. I love it to death. But I'm also a dad. I'm a husband. I am a musician. I am a brother. I am a son. Like, I've got all these like relationships in my life too that I have to make sure that I am connected with and fostering and growing too. But I also love to read. I love to watch movies. I love to go for walks in my neighborhood. I like to do all these things to like really maintain my well-being too. So I think we have to have that balance.
Yeah. No, I think that's very important too, because it's like, I'm an analyst, but then, we can't, we have other titles too, just like you said.
Yeah.
I know for me, like my big title is being a mom. So clearly, like, I'm a behavior analyst, but I'm also a mom, and
Yeah.
I'm a wife. Like, I mean, all of those titles are very true too. And for, a lot of providers too. And I think it's really good for us to come off, and it goes back to being human and being people again and human first. Because if we go in and we're talking with a family and all we are is like a behavior analyst, like that's not great. Like, what else do you like how am I going to relate to this parent? Is all I do is think about ABA all day, and I'm a workaholic, like, and I don't
Yeah,
read any books or I don't watch shows. Like, it's much harder to build that rapport. And the same thing with like the technicians and the clients sometimes too, is just like you have to have other things that you are like or interested in to be able to be relatable to others too.
absolutely, 100%.
So something interesting that you have mentioned that you're comfortable talking about is sexuality,
Mhm.
and that's something that's a very overlooked topic. So what is the importance of sexuality and addressing it as behavior analysts?
So let me start with saying this. I accidentally fell into this. This was not something I ever planned on.
You have a lot of accidents.
A lot of accidents in my life. Like, I've kind of like stumbled into spaces that I'm like, I still cannot believe I'm here, right? And so sexuality, so I started working in the space because I had my first three out of, like, I had 6 clients, and the first 3 clients I worked with in that group of 6 had some type of inappropriate or dangerous, or let me say it like this, contextually inappropriate sexual behavior. Okay, that's going to be critical. That's something I think that we need to spend more time talking about, is contextually inappropriate. So it's important because I think that what I have found is it's a combination of things. One is that there are a lot of myths and a lot of misconceptions about sexuality and teaching sexuality skills to learners. I think people hear sexuality and they conflate that with sex. They think that we're teaching sex to learners. And that's not at all what's happening. Sexuality happens to every single learner we work with. Anybody here is listening who has worked with somebody who's gone through puberty, anybody who's worked on a toileting program, anybody who's worked on body autonomy programs, on being able to tell people no, consensual touch, when you talk about condom use or contraception use, when you work with learners who decided they're going to be on birth control, like, all of those things are part of sexuality training, right? And the thing that I tell everybody is that at the end of the day, sexuality education will happen whether you want it to or not. Now, you can make sure that it's the right information, or you can make sure it's the information that I used to hear in middle school from people, and I was like, that doesn't sound right. I'll never forget, and this is the example I always use. I'll never forget, I was in honors classes in 8th grade, and I was friends with somebody who was in honors classes. This is person, when we talk about this, like, people who are like educated, who are smart, like, who are top of the class, all this stuff, right? And this kid was like, he had talked about how he had sex with his girlfriend for the first time and how exciting that was. And he ended up, and he was like, and I know you don't have to, you reuse condoms. I was like, what do you mean you can reuse condoms? He's like,
No.
well, all you had to do, like, we used this one and then I flipped it inside out. And I was like, that is the opposite of what you should do. Even then I knew that, but like, that's the kind of misinformation that's out there sometimes, is that people just don't know things like that. And so I tell everybody all the time that, like, no matter what happens, sexuality education will happen to you. And most of our work is reactive. When we teach menstrual care, it's reactive because somebody's menstrual cycle's already started. And so we're freaking out and we're going, oh, okay, well, now we have to do this, right? And I think that that's the thing that people misunderstand, is that they think that are teaching sexual skills, and we're not. We're teaching hygiene skills and health skills and things like that too.
And they fall right into it because everyone goes through puberty.
Yeah, exactly.
Everybody has changes and bodily changes. Yeah, I mean, I've worked with clients that, weren't even aware or have, the cognitive awareness of like what a period was, and like started a period. And that,
Mhm.
I'm sure, is a very scary thing, because it's all of a sudden it's like you're bleeding and like, what
Yeah.
do I do with that? So I think that education, and whatever kind of level they are, teach them to the best of like their ability, and being able to teach those things are very important. I can't believe someone in 8th grade, but very young and needed a
Young and
probably
naive,
needed a
and
different lesson on the use of condoms.
absolutely. And I think at the same time too, it wasn't because they had never contacted it. It's just like they just did it was just this misinformation, right? And it's unfortunate because when we talk about, like, the folks that we generally serve, like folks with disabilities, 96% of them never even contact sex education in a public school setting, right? 96% of the learners that we work with never even come close to contacting, and because most people opt out, or it's not catered to their needs and whatnot. So not only do you have a population of folks who never get sex education, you also have a population of folks who are also highly vulnerable. So now you got folks that 96% never contact it, and anywhere between 40 and 80% of people are victims of abuse as a result of this. It's one of those things where it's sexuality education is not just for like somebody's quality of life and well-being. That's certainly part of it, but it's also to prevent harms, and it's a harm reduction strategy.
Yeah, I think that's very important too, and I know it's very touchy for a lot of
Sure.
parents and providers too, like, like, "How do I talk about this, and how do I"
Yeah.
it's so taboo that it's, how do we have this conversation? And also, I think because of their ability to, retain or where they are cognitively to have that information. So what would you say with, somebody, just for example, like they were diagnosed with level 3 autism? Like, how would you, or if they were nonverbal, like, how would you go about teaching sexuality to somebody with that diagnosis?
So that's a great question. And I think, question, this is the answer that drives everybody nuts when we talk about this. Like, it depends, right? But I think what I would say, yeah, it always depends. But I think at the end of the day, the most important thing that I always kind of lean into whenever I enter those spaces is understanding that sexuality education is safety training. So like I go in with that mentality. It's like, what skills can I teach this person today to keep them as safe as possible? I think of, in those situations, hygiene skills. Can we teach hygiene skills to make this person as independent as possible with these skills to prevent the need to have somebody else in that space
Yeah.
with them, right? The more
Right.
we can remove folks from those like more vulnerable spaces, the more likely that they'll be safe. So I think about that. I'm like, hygiene skills, think medical advocacy. Most of the learners that we work with are never told what medication they're on. They're never told that they are on medications. They're never told it's usually like relayed to a caregiver. So being able to give them information about how to advocate for their medical needs, how to be able to report when things are wrong, how to disclose concerns, and how to, those types of things. From there, everything else is mostly fun and games, right? So like at that point in time, you go, okay, if I can keep this person safe in all these aspects, hygiene, if I can keep them safe medically, if I can keep them safe in relationships, if I can do that, everything else is just like more like pleasure seeking behavior, a relationship seeking behavior, those types of things. And you can kind of start looking at those in different ways. So I always try to approach it with a hierarchy of, and this is true for any client that I work with, and is always health and safety above all else. And then everything else kind of falls, inside that health and safety, obviously, like autonomy and agency and all that stuff, but building from there, and really everything else cascades down from that, I think.
Yeah, no, that makes sense because that's how we would approach clients to begin with, right? Like if we have a client that's like, okay, so what's our number one concern? Okay, they like to run out in traffic. Let's work with that first.
Yeah. Yeah.
On safety, like awareness, like looking both ways, holding hands, like let's start there because that's our number one concern. So I think that's true with any, program
Absolutely.
you're working on and reducing, some of those target behaviors too, is that we want to start with the health and safety concerns. So I think what you said falls through. It just makes sense with any program that we work on. And I like how you come in. That's very a professional approach to come in and say, okay, so let's reduce the number of adults and have them as independent as possible. So I think that's a really good perspective.
Yeah, and something I try to do too is like education to the caregivers, right? Because and I think that everybody comes from different walks of life and has different they have very different experiences around and guilt around sexuality and shame around sexuality and stuff like that. And so I think it's really important to provide accurate, medically accurate health information to people in those spaces, and really spend time dispelling some myths. I was born and raised in the South in the United States, so highly religious, highly conservative. And so you're going to have folks that have very strong opinions about it from that like kind of spiritual religious perspective. And so when I have those conversations, it's always, I hear you and I understand. This behavior is going to happen, so let's make sure that we make it as safe as possible because we're never going to suppress it, right? And so that's why earlier I mentioned contextually inappropriate sexual behavior, because a lot of times people want to suppress the entire behavior, but it's like, no, this behavior is allowed to happen, just not in a family room or in public. It can happen in a privacy, in a bedroom or something, but it can't happen here. So let's talk about like discrimination programs, or let's talk about shaping procedures, because that's ultimately what we got to do. So I think that those are the conversations that are a little bit more difficult, is like, this behavior is allowable, but where is going to be important.
Right. Yeah. And I think that definitely it's difficult depending on the family's values, and,
Yes.
it's like, "No, this shouldn't be happening at all," but, it's probably going to happen, so I think that that is a difficult thing too. I really love some of the families that I work with that are just, like, open to, like, "Yeah, like, that's a natural part," and I'm just like, it makes it a little bit easier to come in and be like, it's for everybody experiences this, so but, yeah, it definitely is the challenge, and I understand that, like, I understand that, you know, different values, like, culturally, religiously, all of those things come into play too, so that just makes it a little bit more of a challenge because of the views on sexuality and being able to move through those.
Yeah,
So,
absolutely.
yeah. And I have like, even with, some older clients I have, and there's nothing wrong with, like, wanting to be in a relationship. I've mentioned the show before, that Love on the Spectrum show. I absolutely love that show.
Yeah, yeah, yeah.
I'm a sucker for it. I'm like, I love all of these people
Right?
on here. I think they're fantastic, but I think there's nothing wrong with wanting a connection with somebody else, or wanting a relationship, with some of those older teens or adult clients. But I think the biggest concern is that safety and knowing those boundaries. Have you had any experience with that, or being able to explain some of those boundaries to them?
Yeah, and so it can be really confusing working with adults, because you're going to have folks that are going to be legally competent that can make decisions, and then you're going to have families that say absolutely not. What I see more is less about the boundaries and more about opportunities. And so, when you work with adults, there are very few opportunities for them to naturally meet folks that are peers. Most of the peers they meet are in the same workspace if they're working at like an adult day training center or in a group home. Or Special Olympics. So they may meet folks there. And, what I see most often is like they're usually the adults that are interested in having those relationships and whatnot are pretty good with like certain boundaries. And I think most of the time, because they've spent so many years with people going, you do not do this and you do not do that. And it's kind of like they've got these really clear rules their entire life. So I actually see opportunity as a bigger issue than boundaries. Now, for the folks that do have boundary issues, a lot of that is shaping and being willing and having folks that really, really want to make sure that, like, you set some really clear ground rules, and you're teaching things like consent and whatnot. Consent is a really complex behavior to teach in terms of like radical consent. It should be, and I say that because it should be as easy as, no, I don't want you touching me. No, I don't want to date. And then the person going, okay, it should be that easy, but people are not always so explicit and in their nose. And some people are not always so accepting of their no's. And so those are some like unique complications that come out of that space. But yeah, I think that in all those spaces, that boundary thing is so, so important. And it can be so difficult to teach, because some folks become so enamored with people, and they are just they see somebody and they're like, oh, I just love them. And then it becomes a parasocial relationship because that person's not even connected. There's lots of it's just it can spiral in so many ways.
I think one of the biggest concerns that I find, and again, like, back to the opportunities, is, okay, so they're not around a lot of peers, but they have a phone. And so they're online talking to people. And it's
Yes.
very hard, sometime with those kind of boundaries, because you are open to the whole world, and either you don't have good boundaries, like you don't understand no, or you have a hard time with no, or yourself, like, you don't know how to say no.
Right.
Or, so I think that that can be hard, and plus you don't know who's on there, because not everybody on there, has the same disability as you, if they even have a disability at all, and there's a lot
Right.
of, because it is such a vulnerable population, there's a lot of predators out there too.
Yeah, yeah, and unfortunately, I've seen that happen too. Working in group homes, I've
Mhm.
seen that happen where
Yeah.
folks are connecting with people online and they end up in really bad spaces, or and you're right. There's lots of people that are willing to take advantage of our folks that we work with and that we serve, and it's unfortunate. But that's also, like, to me, that's where I go back and I say, okay, well, we are working on health and safety. So one of these relationship things is the boundary of protecting your personal health information. It's the boundary of, not the boundary, but the skill of understanding online etiquette and having communications and what that looks like. Like there's a lot of skills as you start to get to more complex behavioral repertoires that, like, oh, you don't realize that this is an important component of this. I'll never forget. I was consulting with somebody, and they had this story where they had a learner who had a foot fetish, and they taught the person to ask first to see the person's feet, right? So it was like one of those situations where it's like, okay, so they taught them consent. I am asking appropriately, and they would role play this and they would role play this, and it was great. And I won't go into all the details of the program, but it was an effective program. The person was able to effectively ask.
Good.
What
Good
they
start.
forgot to happen, yeah, it's a good start. What they forgot to follow up on was the naturally occurring no's that might happen. And so what ended up happening was the learner had asked to see somebody's feet in public. The person said no. They grabbed the person and took their shoe off anyway, and it resulted in an assault charge. And so it was one of those things where it's like we were almost there, but we missed that opportunity. And sometimes those things come up and you just don't know or you don't think about it, but you can just kind of see how complex those behaviors get as you kind of move along that spectrum.
Yeah. Yeah. No, absolutely. I know that there was an individual that I worked with where they always had to ask because they just didn't have good awareness on individuals' ages. So she was going around like, "How old are you? How old are you? How old are
Yeah,
you? Can I talk to you? How old are you?" Which is a good thing to ask, but I'm also like, there's also that like socially like I'd rather he ask how old to begin with, but it's also like you're coming up to, a young girl that's like 9 and they're like, "I'm 9." And it's okay,
right,
move on. Are they 18? Is that? Nope, they're not. So we've got to move on. So, and that can be, kind of finding something that would be, like a social norm because I think, sometimes like being out in the community, there's a lot of people out there that don't understand, some of these individuals. Sometimes they do, some other people are great about it.
right,
They
right,
they understand, like, okay, this person, they might have a disability, they're checking into asking the ages, like, if they're appropriate to talk to somebody. Some people don't understand, like, "Why are you asking my daughter how old they are?" So,
right,
I think teaching that kind of social norm can be a challenge sometimes. It's like, so the times that maybe wouldn't be appropriate anyways to ask somebody if I could see their feet out in public, that would not be an appropriate setting for that to begin with.
right, right, exactly.
So I think those social norms are important too. And then also that no, like that's a big one because I know a lot of individuals that struggle with anything with no. So like, no, you can't have a glass of milk right now. Like, or
Right,
that's available. We use that all the time. We say that's not available. And I'm like, I don't have any problem with the no because sometimes I'm like, somebody's not going to tell them that's not available one day. Somebody's going to tell them no. They're not
right.
going to know how to respond. So I like to teach no when I can, when it's appropriate.
And I like to teach the other side too, which is like when we do have staff that say no all the time or parents that say no, I will question. I'll go, well, why? Like,
Yeah. Yeah.
why is this a no for you?
Right.
Let's unpack that, and then
I
that
like that
way we
too.
can kind of ease up the world a little bit around the person because it can be so restrictive. I mean, the first word that toddlers hear more than anything else is no,
Is no.
right? And so they hear no so often, and everybody here who's a parent who's listening can think about that. It's like every time the kid goes to touch something, they go, "No, don't do that. No, no, no." And you got like it's like a panicked parent type of response. Which my kids are 20 and 13, so yeah, I think about that a lot, and it is. It's something that we say so often, so quickly, and not realizing that like we're probably unnecessarily restricting stuff.
Right. Right. And one thing I like to tell parents is like there's always a choice. Like there is always an alternative. Like there's nothing wrong with the word no, but there's always some kind of alternative. So no, you can't have milk, but like you're not going to restrict all drinks, right? So like yeah, like but water's available. Like what else is available?
Right.
So if that's not there, they can't have milk because they had like 5 glasses of milk. Like okay, no, but you can have some water. Like water is an option. So I think that knowing there's always an option is a great way to follow up with that no because in a way it's still accepting alternative, but I don't think there's anything wrong with hearing the word no, but
Right.
also whoever is saying no is like, there's always another option.
Right. Exactly.
It's not no to everything,
Yeah.
but that's so funny you said that because my 14-month-old started saying no, like that's his new word, and I'm just like, I was like, "Oh, man." I was
Yeah.
like,
You go. Oh, it's my fault. What
"Yeah,
What have I
exactly." I was
done?
like, "I did this." But a
Yeah.
lot of times for him, it's a safety concern because he's, reaching for something. I'm like, "No," like,
Yeah. Right.
so I'm like, "No," and then he's like, "No, no." So I'm like, "Oh, great, look what I did." So,
That's my niece and nephew. They have picked up like contextually appropriate profanity,
okay.
and they're like 4 and 6, and so the 4-year-old is the one that she says it the most. But the other day she was having a hard time. I bring this up because it's so funny to see that, when people, like when children start picking up these skills from parents, and then the parents are like, oh my God, I can't believe they said this. And you're like, it's your fault. You did this. Cause she was trying to put on her bathing suit and it was wet. So she's having a hard time, and she's like struggling, and she's like grunting. And then she goes, son of a bitch, and she does that. And like, she's frustrated, and everybody was like, I mean, that's contextually appropriate. Maybe not great, but like it is, she's using it contextually. So it was just funny and I was just like, to my sister-in-law, I was like, that's you. You said that. That wasn't, my brother. That was you. So it was just a funny conversation.
And I love how too sometimes parents, and my husband's guilty of this too, it's like they must have heard that like on TV or something. That's crazy. And it's like, that's you. Like you 100% know that's you. Yeah. So it's very funny. I hear that all the time. It's like they must have heard that somewhere. I'm like, oh.
Yeah, wasn't me. Yeah, I've heard my daughter arguing with her boyfriend sometimes, and she'll say stuff, and I'm like, oh my God, I've said that exact thing to her when we have been having like these deep discussions, and I'm just like, oh, this poor girl. This poor girl is gonna she's gonna be like over extolling whatever philosophical or like some motto while she's in the middle of the argument, and her partner's gonna be like, are you kidding me right now? Like it's like, good luck, you'll be okay, but good luck.
We don't always realize what we're modeling sometimes. So we've
Yeah,
got to keep ourselves in check.
absolutely, you're right.
Yeah. In home and community settings, how can practitioners design interventions that are practical? Because I think sometimes we kind of get lost in like, okay, like a health and it becomes very rigid.
Mhm.
Like how would you kind of differentiate? It's like, okay, so this is like the clinical side, and this is a way that it's very easy to like explain. It's very practical. Like, what are some ways that you find that are practical and sustainable?
Well, that's such a great question. I hold my behavior programs pretty lightly. So I was taught very technically. So I was taught to write TAs and be really clear about it and make sure that the reinforcement systems align with your skill acquisition programs and all that, so that you're getting more reinforcement in your skill acquisition than you are for your problem behaviors and all that. So like I was taught like the way that I write behavior programs is like very technical. But I also heard very early in my career that like you can have a 40-page behavior program, but it is worthless if it's not doable. And so, it makes me think a lot about social validity and what social validity really means. I think that we all talk about social validity and we go, okay, well, social validity, like we're working on socially valid behavior, like socially important behavior. We've got the applied dimension down pat, right? We're good there. But we forget that the social validity model also includes procedures and outcomes. It's not just what we're working on, it's how we're working on it and where we're going, right? And so I think that if you have a really great procedure and nobody can do it, it's not socially valid. So while you're working on socially valid behavior, your procedure isn't socially valid, which means your outcomes won't be socially valid, which means you're not adhering to social validity. If you really want to get into the nuts and bolts of it when people talk about like the behavioral practices, right? So for me, I do a lot of check-ins. I'll write a procedure. I will train a procedure with the family. And before it's like finalized and in a behavior program, I will go, okay, well, what do you think about this? Like, does this feel good? Does this feel like it's doable? And if they agree, then I'll say, okay, we'll go forward with it. And they'll say, oh, I didn't like this part. And we'll take it out if it's not a necessary ingredient for the procedure, right? I think we get so, you mentioned this, like you get so rigid about stuff. And a lot of those conversations are figuring out what the non-negotiables are and you're writing a procedure around those non-negotiables. Like, okay, we know this behavior produces this outcome, so we cannot allow this behavior to produce the same outcome at this level. So this is the main ingredient. Everything else that we build around it is going to be individualized and contextual and doable. And we just got to start there. And yeah, I think having those conversations with folks and like being willing to accept feedback is so critically important, but I think we have a hard time with that. So the short answer is I do check-ins and I talk with families and I talk with the people that are implementing this and I say, how does this feel? And if it doesn't feel good or it doesn't feel doable, then I revise. And for me, I come from a instructional design standpoint too with this. So, when I work with students, if I'm teaching a skill and they're not getting it, then I strip it down. Use different exemplars. I have no problem changing the way that I teach in order for you to get the information that I'm trying to get to you. So I think that's the thing. It's like I don't hold that stuff very tightly when I'm in those spaces because I'm not the one implementing it that day. Like at the end of the day, you are. So like I got to make this doable for you.
Yeah. No, I agree. And I think one thing I fell into when I first started and I was behavior analyst and actually the first company I worked for was PBS and I there was the one where it's the parent training and I'm like, okay, so I don't know what to write for parent training. I don't know what to teach the parents. And one of the examples was like the data collection. And I'm like, okay, so yeah, so I put that in the plan. I'm like, oh yeah, data collection. That sounds great because they can collect data and I can collect data and I can see what's going on when I'm not there.
Yeah.
And I I have had one parent since I've used that goal, one parent, one time, filled out an ABC form.
Yeah.
Because they're let's like, the reality is they're busy, like, it's not a realistic goal for them, like, they're like, "I'm not gonna collect, I'm not gonna do it."
Right.
I'm busy and I'm not gonna do it, and sometimes it's like, "Isn't that your job?" Or like but they also give good feedback, like, "Hey, like, this happened on Friday," like, they started hitting their head at the park or whatever it is. So you have some, like, we have a report from parent, we just may not have it like, "Okay, but did we collect that data?" No. Like, so I
Right.
think sometimes that rigidity and I think that also doesn't help with that relationship building. If it's like if you're asking them to come in, you're trying to build rapport with this family and you're asking them to do something they don't wanna do, and especially parents that are, like, brand new to ABA, they're like, I'm not gonna do that." Like, and then sometimes it's like, "You're lucky if I have time to meet with you, once a month." So,
Right. Yeah.
I mean, they have a busy schedule too, and they have life, and their life is lifing, and they're like, I'm probably not gonna do it." I've only had one parent that ever did that.
Yeah, I mean, I was very fortunate enough to have a lot of parents that did want to, and
Okay.
I say let me say it like this: not that they did want to, and that other folks don't. It's that they like we were able to work together to figure out a data collection method that made sense, right? So I think that's the other side of it is I think you can make the argument that, it's especially in data collection and participation, it's like that's great that you can get somebody to collect data, but I hear parts there I hear lots of different perspectives on this. I hear Greg Hanley in the back of my head going, parents are supposed to be parents, they're not supposed to be interventionists, they're not
Yeah,
supposed to be data collection
right.
people, and it's like, yes, that is valid. However, I came up in the space where we didn't have RBTs. So, and we had 3 hours a month to work with somebody. So, like, the data that we're collecting in that 3 hours a month is not going to be sufficient
Not
to
as
make
efficient.
decisions. So, we have to have conversations about who's collecting data, how to collect data, what's doable to collect data. And so, a lot of it was like figuring out useful and practical ways to collect data, right? So, that's again, I think that goes back to that same thing that you're talking about is like, it's great to have a parent goal. And I think lots of parents do have those parent goals. And we're going to have parents that do not want to collect data, that do not want to be involved in that. But let's have the conversation, think about like why that's happening and why they're having a hard time with it, because it may not be them. It may be our system. It may be our process. It may be something like that.
Yeah,
It may be
you're
the
right,
expectation of
you're
services,
right.
right? Like
Yep.
maybe they had ABA before and nobody expected them to do this part of it. I think there's lots of features there to look at. And I think I think you have to, I think every behavior analyst should really take time to reflect on what's my ultimate goal in asking this person to do this? Like, and is that goal movable? Like, can I let go of that goal in lieu of something else? Like, there's got to be those, I think we have to have intellectually honest conversations with ourselves about that and go, like, is this so necessary that I'm willing to damage the relationship with this person just to get a couple data points? And it's probably not, right? And so I think I've learned to kind of let go of some of those spaces. And I'm like, okay, hey, don't collect data. RBT and I will collect data. We'll do sample data, and that's the best we can do in this circumstance.
Yeah. No, I think that's a great point too, and I think you're right. It's not always the parent, even they're busy, like, it could be our systems too, like, it's not necessarily them or, like, their fault or something.
Yeah.
I just think that, sometimes it's like, but is that really so important? I mean, I could see in that scenario where it's like, okay, I don't have an RBT, so, like, the 3 times I see them, a month or whatever, like, that's really not enough data to see how they're doing and, like, what kind of progress they're making. But most of the time, I'm like, is that really training? I mean, like, yes, they know how to collect data, but, like, what am I really teaching them? Like, how is that going to help them, learn to reduce some behaviors or increase the behaviors we want to see more of, like, how is that teaching them any skills at all, like, other than, like, all right, how to document what's going on, you've observed it and you know that that's happening.
Yeah.
But, like, what do you do about it? Like, that's the thing is, like, okay, so you participated in a session and you collected data, like, but what do you do about all of these behaviors? So I think that there's more depth to than just taking data. Like, data can be a goal, but there definitely should be other parent training goals, so,
Yeah,
um
absolutely. There should be priorities. I mean, personally, I use data collection as the entry point to buy-in. So, like for me, I think it's easier to teach data collection than it is to teach a procedure. So, and I say that because like, okay, like you did collect ABC data. This is great. Here's what I learned from this. And like being able to communicate with the family to go, here's what you did. Here's how I can use this. Here's where we're going now. Like, so like to show that there
Ooh, I
is an
like that
outcome.
perspective. Yeah.
Yeah. And so like, when I think about data collection, I think of like from the very beginning on day 1 when I start doing assessment. Like I am like, I always tell them like the more information that you're able to give me, the better I am able to help you in the situation. So let's have a conversation about that. Here's my first entry point, which is ABC data during assessment. And I go, if you can fill out just a couple of these, I don't need it doesn't need to be perfect. I just need some examples of this. And that's usually my start for buy-in. And so to kind of set the expectation that like, hey, we're going to be doing this together. We're going to be collecting data. What does this look like? And so that's usually where we start. And that's been, for me, that's been really effective. But everybody's got different experience and a different way they talk about that too. So
No, I think that's a really great perspective too, and I like the idea of, like, let's do it together because I think if parents, they feel like they're doing this on their own, it's like a homework assignment, that's a very different like, I don't want homework assignments either, so I think that's a great way to approach it, like, if you're gonna ask for data collection, be like, "Hey, like, just take a couple of these and, like, we're in this together, like, we're gonna do this together, we'll collect the data," and, like, so I think that's a great way to approach it.
field. I would like to see more support for each other. I think that our field has a lot of infighting. I mean, I'll make a list, but I do think that I think that our biggest problem is ourselves. I think that we are getting in the way of our own progress in lots of different ways. I think that we are siloing ourselves from other fields and pretending like other fields science doesn't have as much of an impact as ours does, which is just patently untrue. I mean, working in the sexuality space, I can tell you right now, they're light years ahead of us already. So like we're already behind. So I think that I would like to see that. I would like to see better dissemination and advocacy for our field as a profession. I don't think that we could do that until we align more, but I do think that that would be impactful for getting funding sources to buy into what we're doing. I think that would be helpful for legislation. I think that would be helpful for expansion. I would like to see researchers make things more practical, and I would like to see research journals be a little bit more open access. I just tried to pull up an article from Behavior Analysis and Practice today, and it's not accessible to practitioners for over a year. So now you can go into for behavior analysts that are listening here, you can go onto the BACB and you can log into Behavior Analysis and Practice, but you can't access any journals that are less than a year old through that process. You have to have a subscription, which is absurd that science has a subscription. So I would hope that we can take the journals to task a little bit and hold them accountable to that regard, because I think that we need to have more accessible science, especially if we're supposed to be using the best evidence possible. We need
I
to have
agree.
the access to the most recent service or the most recent research. I think that the move to RBTs having PDUs is great. And continuing education, I think that's beautiful. I think that we need to do a better job of systemically supporting RBTs. So I think that's going to be the field coming together to do that. I think that we need to improve supervision standards. I mean, like I said, the list can go on and on and on, but I do think that's kind of the way I think of it. It's like
I gave you a
let
pretty
me
open-ended question too.
yeah, and that's
Oh, yeah,
fair and it's
okay.
good, right? We
It
need that.
depends.
It depends. There you go. That's the answer. But I will say this,
Right.
and maybe I can end it on this is like I so deeply love our field. I love our practice. I love our science. I love what we do, and everything that I say always comes from that place of love and understanding, right? And respect for our field. Like I would never critique our field this way if I didn't care about what it's doing and I didn't care about the impact it has, because I've watched the impact and I think all of us have. So anytime I say this stuff, I think people think of me being like hypercritical and like being like maybe even cynical about stuff. And it's really not that. It's I'm hopeful because I love our field. I love what we do. And I know that we can do better. And I know that we can improve. And I know that we can progress. And I say this out of love. I always say this out of love and respect for our profession. So hopefully we can start working on all those things. I know it's a large systems change. It's a culture change, but I think that we can do it. And I think that we're moving in the right direction at least.
Yeah. Yeah, I think so too. I think we have a long way to go, but we are heading in the right direction too. So,
Yeah, and there's no finished product, right? There's no
right.
finish line.
Absolutely.
Science
Right.
doesn't have a finish line. So, but I think we're moving in the right direction, I hope.
Yeah. Yeah. No, I agree. I agree. So I love to see what the future holds, like where we'll be in the next 10 years. So
Yeah,
hopefully we continue in the right direction. So
fingers crossed.
yeah. So Shane, I just want to tell you thank you so much for coming on. Is there anything else before we sign off that you would like to share with our listeners?
I think what would I want to share with my listeners? I think there's lots of people out there doing really cool work right now that are not necessarily linked to universities. And not that I don't believe in the university work, but I do think that there are some really cool independent practitioners out there. Some really cool books and resources that are out there. I think that specifically Jen Ferris, Meg Thompson, Maricera just put out this book, Reframe. I think you should go check it out. It's incredible. And yeah, support practitioners who are doing cool work, because I think that there's some really cool things happening right now, that our field is really growing and evolving, and we're going to see some really cool things in the next few years. So
Shane, thank you so much for coming on. And hopefully we'll do another episode soon.
yeah, just let me know. I'm happy to hop on.
All right. Awesome.